The Public Health Agency of Canada is warning travelers could find themselves subjected to isolation or other measures abroad aimed at limiting the spread of the monkeypox virus.
Now, this comes as Ontario's remaining mask mandates are set to end this weekend. For more on these two issues, we're joined live by Dr. Abdu Sharkawy, infectious diseases specialist at University Health Network. Dr. Sharkawy, good to have you on the program this afternoon. So let's talk first about the mask mandates, sort of this thing that we've been, getting so used to over the last 18 months to 2 years now. Conversations happening behind closed doors with Dr. Kieran Moore about the mask mandates. What would you like to see continue, or where would you like to see the mask mandates go in this province?
Well, personally, I think that wearing a mask indoors is still a very important way to prevent not only the spread of COVID-19, but a lot of respiratory viruses. So personally, I would prefer to maintain a masking policy in indoor settings, especially settings in which susceptible individuals may have to frequent. And that may include healthcare environments, obviously, pharmacies and supermarkets and things of that nature. I understand not everybody agrees with me, but personally, I will continue to mask indoors for the foreseeable future, not just to protect myself, but more importantly, to protect others who I think are still fairly susceptible and frail and whose immunity may have waned from the last time they were vaccinated against COVID-19.
Mm-hmm. Dr. Sharkawy, the Public Health Agency of Canada is warning travelers to take extra precautions when they are traveling abroad. But let's remind our viewers what exactly that precaution is. We know that monkeypox can be spread person to person. So are we talking about limiting skin-to-skin contact? Are we talking about avoiding ingesting bodily fluids? What exactly is the protocol here?
Yeah, I think coming off of COVID, there's a real sense of maybe fear or panic and alarm about any sort of transmissible virus. And we have to make a distinction between the two. COVID, you can catch by being in the same room as someone who happens to be symptomatic, and you may not even have any sort of direct contact with them. It's not really the case with monkeypox. Monkeypox can aerosolize, but it's a very minimal amount compared to COVID. So the main mode of transmission is really close, intimate contact with someone, skin-to-skin contact. And unlike COVID, you can get it from the bed sheets. You can get it from the pillow, because if the individual who's infected has been around there and you're in contact with those pieces of furniture or any sort of fabric, you have to be careful. So it's a little bit of a different risk. Masking is probably not quite as important as it is with COVID, but anyone that you're with or have been with, if they've got a fever, if they've developed a rash that may be like monkeypox, you've got to be cautious about the environment in which you are frequenting.
Dr. Sharkawy, what would you say the relative risk is of monkeypox? How do you put it into context as compared to what we've just gone through or what we continue to be going through with COVID-19?
It's a different ballgame altogether. We certainly don't want to equate the two. There are going to be super spreader events simply by somebody coughing in an indoor setting to susceptible individuals with COVID-19. The same is not going to be the case for monkeypox. We're talking about intimate contact here. The clusters of cases that we've seen, especially in Quebec and other parts of the world, are largely around intimate contact, often of a sexual nature. So this is about making smart decisions with intimate exposures, and about recognizing that if you or your partner develops a fever or an unexplained rash, you better think about monkeypox, isolate, and take precautions as soon as possible.
Dr. Sharkawy, given how monkeypox has been kind of spreading silently, how exactly does the government tackle this by trying to get rid of all, the monkeypox cases?
I think it's important to have public health messaging that's clear and consistent, and not to confuse anyone by equating what happened with COVID-19 with what's going on with monkeypox. And monkeypox is a bit problematic because we don't have vaccines that are very reliable to protect those who are at risk. We've got modified smallpox vaccines that kind of have some protection. We don't know quite how much and how well they'll work, but there is a ring vaccination sort of platform that's being used right now to try and offer it to close contacts and cases. in some parts of the world. We don't know if that's going to play out over a mass scale. So I think the more important thing right now is to just remember to be cautious, to make smart decisions about your sexual exposures, your intimate contact with anyone, and recognize the symptoms, especially when you're in big gatherings like parties and other social occasions that may be conducive to that type of behavior and exposure happening more often.
Before we let you go, Dr. Sharkawy, I just want to clarify, you keep mentioning intimate contact, so should the messaging around monkeypox be that it's like a sexually transmitted disease?
It certainly can be. I imagine most sexual contact will involve skin-to-skin contact. So, if you're touching someone, that's all it takes. You're not going to get a lot of other viruses simply by touching. But kissing, touching, hugging, skin-to-skin, mucous membrane contact, all fair game. So you've got to be careful with that.
All right. Infectious diseases specialist, Dr. Abdu Sharkawy, appreciate your time. Thanks.
Thanks, doctor.
Thank you.